Waiko Hoitap, Kamlux Quest Wunakchina and Jao Kukpi7. For those of you that don't know me, my name is Chief Wayne Christian. I'm the chief of the people of Splatsin. We're in a real unique and different situation regarding COVID-19 and the worldwide pandemic that's taking place right now. So I'm here to let you know what we're doing here as a community and how important it is that we react. We established our emergency pandemic plan, operational plan on March 13th. On March 14th, we began to look at the issue of the Emergency Operating Center and established that on March 18th. The Kukpi Nation as a whole, all 16 communities established a state of emergency on March 23rd. So we're really in that place right now where we really need to be looking at what's going on. We've been in constant processes in terms of proactively planning. We're on calls every day regarding a clinical update as to what's happening with our health staff and some of the issues arising from that. And we're in constant planning with our Emergency Operations Center looking at food security. A number of things have happened so far in terms of actually providing food security for the elders and making that available to others. We've established a community crisis team made up of staff members and band members that are looking at the actual delivery of food stuff. We've established accounts for food with a number of distributors and established a community center as a depository for the actual food and how we get that out to people. So we've been very proactive in what we're doing with the COVID-19. What's really important in this whole process is what people are calling social distancing, but actually it's physical distancing. We want people to be apart from each other at least 6 feet. We've canceled all the gatherings. We've closed the community center. We've gone to essential services and our band administration. So the staff is still available, but only through phone and by appointment only if you need to see them. So we're still operational. It's just a matter of how we're doing business is different. This virus, as you all know, has taken its toll worldwide, and that we've been fortunate so far in this part of the world. We don't know if there are active cases, but we have to act like it's in our community. We have to act like people, because asymptomatic or people that don't show symptoms still are active carriers of the virus. We're finding from the medical people and the World Health Organization, of Public Health Canada, and the BC CDC, the Centre for Disease Control. So it's really important that you as individuals understand your role in this process. We ask you not to gather in large numbers. If you're gathering with those in your own household, that's fine. That's what is acceptable in terms of what needs to happen. But really no large gatherings, and we're in a state right now, they're talking about flattening the curve. And actually the best way to do that is to stay home, stay physically distant from people, and also look at washing your hands and not touching your face. If you're going to cough into your elbow like this, you cough into your arm, those kinds of things. The other thing is, if you're showing signs and symptoms of any kind of flu-like symptoms, contact our health department. We've established through our pandemic incident command center an actual process for people wanting to contact health. We've established that. If you have other needs related to food and other things like that are really important, we've got an emergency operations center. We have a phone number where you can contact them as well. So it's really important, again, that you as individuals understand your role in this. This is a worldwide pandemic, and we responded as quick as we could. It was announced in the early part of March, and we responded within the first week in terms of establishing our pandemic plan and then establishing our emergency operations center. So again, I ask you as individuals that what you do and how you conduct yourself in terms of your own safety is really important. I personally have health issues, and it's really important to me that I stay away from crowds, I stay away from those kinds of things, because I'm in that high risk category. The elders of our community that have any kind of respiratory issues or that are health issues are really at a high risk. And so it really wouldn't take much, and I think we really have to understand we need to do this for our families, for our children and grandchildren as elders, that we need to take responsibility and show the way in terms of what we need to do. So I ask you again, each and every one of you, take what you need to do for yourself and look after yourself. You have to remind yourself that pandemics and our people is not a new thing. Our community here in Splatsin were infected by the smallpox and the Spanish flu from 1860 to 1920. And virtually our community was almost wiped out. We went from over 1,500 people down to less than 100. So we understand the impacts of pandemics, and I think we have to be really careful in terms of how we look after ourselves, how we look after our families. We need to do what our elders did. You know, one of the things that's important we have to understand is that our elders, many years ago in the 1800s, the first thing they would do, they would ask Kukpi7, the creator, for help and guidance. And I think every person needs to do that in your own way. Pray for yourself and your family and do what needs to be done. The second thing that our elders did, our ancestors did, and why we're still here, is they planned. They planned out what they needed to do for themselves and their families. Like, we're entering that spring season right now. It's really important we begin to think for the future, think for our food stuff. I think we're really showing that we really need to reestablish our own gardens in our own homes. We have community gardens, yes, but families need to establish their own, vegetables and things for yourself. Even growing potatoes for yourself and growing carrots, things that can be stored over the winter. I think those are the things you need to begin to look at. And again, looking at this time of the year when the springtime fish are running in the rivers, before the spring thaw happens, you've got the trout, you've got the dolly, you've got all those fresh fish that our people depended on to survive. Think about those kinds of planning things at this time. So it's really, really important. The other thing that our people did to survive is they worked really hard. They really worked hard to keep us going and worked with the seasons, because this is going to go on for a little while, so we have to think about the spring, we have to think about the summer, we have to think about the fall, and then into the winter. So begin to plan out for what you need to do. And as much as we can help as a council and as a community, we will do that, because it's really important we sort of help each other. Because in our language, it is kunukhantwach, helping each other. And so that's really important. That's why we do what we do, and I think it's important. There are many things that I think you as individuals can do, but it's really important you stay physically distant, but stay emotionally connected. Because the biggest thing that's happened is people get isolated and they can't connect with each other, and it's hard for them. So I ask you to take the time to connect with those people in your family. And honestly, if you don't have a phone, let us know. We can try to get something to you so you can actually keep connected with people, because that's the biggest part of this whole isolation, self-isolation, the social distancing that's going on right now. People are having a difficult time with that. You can have it within your families, but then within the circle of friends and other family members that don't live with you, you have to stay connected to them. And the elders that you know that live alone in your family, contact them on a constant basis, not so much to harass them, but more to stay connected, to say that, hey, I care, I really care for you, I love you, and you matter to me as a family member, as an elder. So contact them in that way and let them know how important it is. For the little ones, the children in the homes, they're probably wondering what's happening. They have a lot of questions like, what is the COVID? What is it? What is happening? Or why do we have to stay away from each other? It's hard for them to understand, and as much as you can, get them to look at what's going on and explain to them in your way and educate them in what's going on with the COVID and this pandemic. Because it's hard for those little people to really understand what's happening, because their whole world has been turned upside down. There's no school, they're not able to go meet with their friends, they're not able to do the things that they do, especially at this time, like the Easter is coming up, and if you can, look after your family and do those kinds of things. The federal government has initiated a number of different initiatives for supports for people, all Canadians as well as First Nations. We are just in the process right now of releasing to all our members resources, those financial resources based on adults and children, and that'll be released shortly for all the community members that live on reserve, and that's the way the funding has come down, and that's how we're releasing it. So again, I ask you to think really clearly about what you can do to prevent this from continuing to spread, because it looks like, as people are saying, the first round is going through and maybe into the summer, then we may see something again in the fall. So again, I ask you to really stay connected with your family and really look after yourself, and I think it's really important at this time. If there are issues that are happening for you, again, we've established contact numbers for the health side of things and with our emergency operations center so that you can actually get help when you need it. So again, I thank you for your time, and I really ask you to really think about how you as an individual, as a parent, as a grandparent, as a child, can really contribute to the health of all by looking after yourself and really paying attention to the social distancing, the physical distancing, and not creating those venues where you're gathering in large groups, because it's banned right now. And that's how this virus spreads, is in that process. And I think it's really important. It's really important you look after the hygiene. If you're going out, send only one person out to the grocery store from your family. Wipe everything down with disinfectant. If you don't have that, we're getting pandemic kits for the homes and for yourself, so you can look at those kinds of things, because this stuff stays on surfaces, and that's really, a lot of stuff is handled, and I think we've got to be clear, you've got to clean it off before you use it. So again, I ask you to take the time and think about what you can do for yourself and your family as we go through this, and we'll continue to update you. We do weekly updates we deliver to the homes. We post on our Facebook site, we post on the website. So everything we can, we're trying to get information out to you. And remember, don't panic at this time. Really think clearly about what's going on with this and listen to this stuff, because there's many different rumors and things. Listen to the actual facts that are coming out from the medical people. Listen to those things, because those are the things that are going to save you and save your family and save us from harm as a community. One of the things that's really important for all of you to understand is that we do have mental health supports available for you. We not only have the health in terms of the nurses, we have mental health professionals that are available to you, as well as, like I mentioned in the Emergency Operating Center, the things you need in terms of foodstuffs are available through that process. So we're looking after your health, we're looking after the mental health of yourself, and looking after the sort of the physical in terms of the foods. One of the things you may want to consider, and I don't know if it's important for you, but if you require sort of any kind of spiritual guidance or help in that way, ask for it, and we can get people to come drum and sing for you in your home or outside your home, whatever you require, because those things are important to our people. So if you're looking for those kinds of supports, we're able to give them to you if you ask us, because there are people here in the community that would readily go to your home and drum for you and sing for you outside your home. So again, there are supports of all kinds. Just ask for it, and we'll try to help you as much as we can. So again, it's very important to understand there are a lot of supports in place, and we're trying to do everything we can, because isolation for people is a very difficult thing. And when you're disconnected from other human beings, it gets kind of lonesome. So again, those of you that are alone and family members that know you have people in your family that are alone, contact them, make connections with them. It's really, really important. So again, I thank you for your time today, and consultant, all my relatives, and I ask you to look after yourself, and I pray for each and every one of you and your families to be safe at this time. Look after yourself. Kukpi7.